All right, welcome to The Explainer. Today, we're going to tackle one of the most important and, let's be honest, sometimes one of the most challenging parts of nursing, spiritual care. But look, this isn't just some touchy-feely topic. We're going to break down how your actions can directly impact a patient's actual physical healing. So let's just dive right into this, because this is where things get really cool. The answer connects the art of nursing to some pretty solid science. We're going to map out exactly how your presence at the bedside can trigger a powerful healing response throughout the entire body. So here's our game plan. We're going to walk through this using the nursing process you already know. We'll start with the foundation, then move to assessment, diagnosis, intervention, and finally, we'll wrap it all up. By the end, you'll walk away with a concrete set of skills you can use on the floor and, you guessed it, to ace your exams. Okay, first things first. We have to nail down the crucial difference between spirituality and religion. Getting this right is absolutely fundamental, and you better believe the NCLEX loves to test this distinction. Okay, so here's the big takeaway. Think of spirituality as this super broad, universal thing. It's that inner awareness, that connection to something bigger than yourself. Religion, on the other hand, that's more of a state of doing, right? It's a specific, organized system of practices. And this is key. It means every single patient you'll ever have has a spiritual side, even if they're an atheist or agnostic. So how does this actually play out in real life? This is where it gets interesting. Picture this. Your 25-year-old patient says this to you. They're telling you they don't have a formal religion, but they've just handed you a massive clue about their health and how they cope. So how do you read this? Well, the correct interpretation is that this patient is expressing a really healthy sense of spirituality through their connection to nature. They've literally told you their coping mechanism. This isn't a problem, it's the opposite. This is spiritual health in action. All right, so that brings us to assessment, and this is where we really get to work. Your number one job here is to understand the patient's specific beliefs, not to guess. Making assumptions is a huge safety trap. You know how chaotic hospitals can be, so just finding a quiet corner for these important conversations is step one. Use those open-ended questions to really get them talking. And I'm going to say it again, never assume. Just because someone has a religion listed on their chart, it doesn't automatically mean they follow every practice or want their pastor called. You've got to ask. And this table, it perfectly shows why this stuff is a major safety issue. These aren't just preferences, they are deeply held beliefs. Ignoring a halal or kosher diet causes real distress. But ignoring a Jehovah's Witnesses directive on blood products, that's not just a mistake, it's a catastrophic violation of their autonomy. You absolutely have to know these. Okay, let's put this into a real-world scenario. You walk into this super high-stakes situation where a patient's beliefs are on a direct collision course with a life-saving order. This is where your assessment skills are really put to the test, under pressure. So what do? What's your immediate priority? It's not to hang the blood. It's not even to call the chaplain yet. Your first, most important action is to hold the blood and go straight to the patient, to directly assess their personal wishes. Their autonomy is everything here, and you have to verify their choice before you do anything else. So what happens when your assessment does uncover a problem, maybe a loss of hope or some kind of inner conflict? Well, that's when we land on the nursing diagnosis of spiritual distress. And it often shows up in very specific ways, depending on the type of illness they're facing. If you can recognize these cues, you can get ahead of your patient's needs. So next time a new trauma patient is angry and lashing out, you can reframe it. It's probably not a personal attack on you. It's a classic symptom of spiritual distress from a sudden, life-altering event. The same goes for that sense of powerlessness that so often comes with chronic illness. And then you might encounter something really profound, like a near-death experience or an NDE. Patients are often terrified to even mention this. They're afraid you'll think they're losing their mind or just dismiss them entirely. So what's the most therapeutic thing you can possibly say in that moment? It's all about validating their experience. Just saying something like, "That sounds like a near-death experience. I'm here to listen if you'd like to tell me more." That simple statement normalizes it, gives it a name, and creates a safe space for them to process something huge. Okay, so we've assessed, we've diagnosed, now what do we do about it? It's time to intervene. And believe it or not, the most powerful evidence-based tool in your entire toolkit is simply your presence. Look, as nurses, we're always running around, right? It's so easy to get caught up in the doing for, hanging meds, checking vitals, charting. But the being with, actually sitting down, making eye contact, and just listening, That is what breaks through the isolation and builds the trust that is so essential for healing. And this right here, brings us all the way back to the question we started with. This is the science behind how your presence physically speeds up healing. Your action, a psychosocial intervention, kicks off a direct physiological response. You're activating the parasympathetic nervous system, the rest and digest system, which triggers the relaxation response. This lowers their heart rate, their blood pressure, and it allows the body to redirect its precious energy toward physical healing and cellular repair. Of course, there are other great interventions that build on this foundation. We can help them mobilize realistic hope. We can bring in chaplains, always with permission, right? And we can make sure they have the privacy and time they need for their own practices, like prayer or meditation. It all works together. All right, let's boil all this down. What are the absolute must-know, high-yield points for your exams and, more importantly, for your practice? If you walk away with nothing else, burn these 4 points into your brain. 1. Know the difference between spirituality and religion. 2. Spot those classic cues for spiritual distress: anger, powerlessness, fear. 3. Remember that just being there is one of your most powerful interventions. And 4, for patient safety, you have to verify a patient's personal wishes about blood products. And there you have it. That's our explainer on spiritual care. The huge takeaway here is that those 5 minutes you spend just sitting and listening, that is not doing nothing. Not at all. You are actively creating a physiological state within your patient that promotes healing. By tending to their spirit, you are directly helping to heal their body.